Patients are often very concerned about the safety and use of topical steroids. They get a lot of conflicting and misinformation from social media. They're also wondering whether there is a cure. Here's a typical scenario that you might encounter in your practice. Hello, Kobe. I'm Lee Chin. Thank you for coming today. How can I help you?
I've had eczema for a very long time, predominantly hand eczema that I managed to treat with topical steroids and moisturiser. I've also got a little one and I'm just a bit concerned about use of treatments on her and whether they can be damaging at all, so I'm after some advice with that.
Yeah, so topical steroids are the single most effective and easy treatment to use to help eczema because it is safe and we use it when we need to, and we use it intensively to the areas that are affecting your little bub, and then it clears and then we stop. And when we do it that way, it is completely safe. There is no side effects of I'm sure you've already heard of the myths surrounding topical steroids such as skin thinning and growth retardation. That just doesn't happen if you're using it to eczema areas until it clears and then reusing it when you need to.
I get scared as a mum. You see things in the media, you see things in social media groups talking about topical steroid withdrawal. Yeah. How do I know, 10 years from now, 15 years from now, I haven't ruined my child's skin or given her, this withdrawal syndrome that seems to be everywhere at the moment?
Yeah, I'm so glad you brought this up because it's everywhere now, isn't it?
It is, and it's confusing.
The news. So, topical steroid withdrawal syndrome is so rare, and it is found in adults, female adults particularly, and on the face. And it's when you use a very strong steroid regularly, every day, for 6 to 12 months, when you don't need to because you don't have eczema. And that then causes a reaction that presents as it's like burning red skin, very different from eczema. Mm-hmm. And often there's this confusion between the two, and it really, what makes me so upset is that so many patients hear about it and are so afraid to use steroids and therefore don't treat their eczema, and their eczema then presents and then they think that they might have got steroid withdrawal syndrome.
Well, yeah, I get panicked when my little girl has a flare and we've treated it, and then sometimes, there might be a flare 2 days later and you're thinking to yourself, is it a flare? Is it this withdrawal?
Yes.
And it is, it's scary.
It is. But it is not, it is so rare and it doesn't apply to 99% of the patients. And in that 1%, it's because the steroid was used in a wrong manner.
I know that you said it won't cause skin thinning. How about patches of white skin or pigmentation? Will the steroids cause problems with her skin?
A lot of people ask me that. And they're worried that the topical steroid, after they've used it, causes those white patches.
Yeah.
That is not true. In fact, it's because the eczema was so inflammatory that it then took out the pigmentation temporarily. Oh. And it will come back, and it will come back within 3 to 4 months. The longer you don't treat with the topical steroid, the longer that what we call post-inflammatory colour change will last.
You spend a lot of money on creams, lotions, things like this, trying everything. I've seen things about injections that people talk about of being like a miracle that just takes everything away. Isn't there an alternative to using the topical steroids?
We live in the best time in terms of medicine for skin and dermatology, and we have these amazing new medications. One's an injection and one's a tablet, but they are for moderate to very severe eczema. And you have to fulfill a certain criteria to be able to be eligible for these medications. And we can control the majority of eczema with just the use of regular moisturising and avoiding triggers and using topical steroids when you need to. I think if we're expecting our patients to use generously topical steroids, we have to prescribe enough for them to use and cheaply. So I highly recommend writing an authority script.
Because my daughter goes to childcare and one day she'll be at school, I know how to moisturize or, how to apply the steroids. What can I do to make sure everyone's on the same plan, or even so that the GP knows what kind of treatment she needs, and so we're all on the same page?
Yeah. You know what we have? We've got a fantastic eczema care plan, and I will fill it out. It's just one simple sheet, and it will tell everybody what we need to do to help your little bub. So the moisturisers and how frequently, and the topical steroids and when to use it and what to avoid. And then we can give it to everybody.
I feel like I'm so lucky to have crossed paths with you. I know that there's so many people out there, or you see mums on social media and things like that, that are desperate. Like, where can people go? Like, when there's misinformation on things like TikTok, Facebook, things like that, like, is there a good resource that's, research-based, proper information, not someone's account of what they think's going on in their body?
Yeah, there is a fantastic resource, and it's called Eczema Support Australia. And it has a huge amount of information, all of which is researched, it's understandable. You can also download toolkits, and they are for your daughter's teacher, for school, for daycare, so that they are well aware of what's going on. So it's a fantastic resource. My objective is to listen and to gain trust, which is not going to happen in one consultation. It's a journey, and eventually to work together so that their skin improves.